12 Weird Signs of Nerve Damage. Nerve damage, medically known as peripheral neuropathy, can result in an array of unusual and often perplexing symptoms. Many people overlook these signs, attributing them to temporary discomfort or unrelated health issues. However, nerve damage can progressively worsen if left untreated. This comprehensive guide dives into 12 lesser-known and surprising indicators of nerve damage, shedding light on their causes, effects, and what they might signify about your health. 1. Tingling or pins and needles sensation. A common but peculiar sign of nerve damage is persistent tingling in the hands, feet, or other extremities. Unlike the temporary sensation from sitting awkwardly, this symptom can persist or recur without an obvious cause. What causes it? Damaged nerves send erratic signals to the brain, creating a sensation of prickling or electric shocks. Conditions like diabetes or vitamin deficiencies are frequent culprits. Why it matters? Ignoring this symptom might lead to numbness, affecting mobility and fine motor skills. 2. Unexplained burning sensations. A burning or hot feeling, especially in your feet or hands, could signal nerve damage. This sensation often comes without heat exposure. Potential causes. Nerve fibers in peripheral areas may overreact or misfire, a condition commonly linked to diabetes or excessive alcohol consumption. Impact on daily life. Chronic burning can disrupt sleep, hinder physical activity, and affect mental health. 3. Hypersensitivity to touch. Allodynia. Have you ever felt pain from something as harmless as clothing brushing against your skin? This heightened sensitivity, called allodynia, is a strong indicator of nerve irritation or damage. Physiology behind it. Damaged nerves sometimes amplify minor stimuli, causing discomfort where none should exist. Common triggers: fibromyalgia, nerve compression injuries, and shingles. 4. Muscle weakness or twitching. Weakness in certain muscle groups, particularly in the arms or legs, may indicate motor nerve damage. Twitching explained. Damaged nerves misfire, causing involuntary muscle contractions or fasciculations. Risks: muscle atrophy, limited mobility, or loss of coordination if untreated. 5. Numbness in extremities. Numbness often accompanies tingling but can manifest independently. This loss of sensation is alarming, especially when it interferes with daily tasks like gripping objects. Underlying conditions: diabetes, autoimmune diseases, or prolonged compression of nerves, e.g., from poor posture or repetitive strain. Potential dangers: injuries may go unnoticed due to reduced sensory perception. 6. Digestive issues. Nerve damage isn't always localized to the limbs. It can affect internal systems, leading to unexplained constipation, diarrhea, or bloating. How this happens? The autonomic nerves, which regulate involuntary functions like digestion, might fail to send proper signals to the intestines. Health implications. Long-term digestive issues may lead to malnutrition or gastrointestinal complications. 7. Sweating abnormalities. Excessive sweating or an inability to sweat could signify autonomic nerve dysfunction. Why it happens? Damaged nerves disrupt the body's ability to regulate temperature, causing sweat glands to either overactivate or shut down. Possible conditions: diabetic neuropathy, spinal cord injuries, or Guillain-Barré syndrome. 8. Sharp, shooting pains. Sudden, severe pains that resemble electric shocks often indicate nerve compression or inflammation. Locations: these pains commonly occur in the lower back, sciatica, or neck but can radiate into limbs. What it reveals: herniated discs, pinched nerves, or even infections like Lyme disease might be to blame. 9. Difficulty with balance. Poor coordination or frequent falls may result from nerve damage interfering with proprioception, the body's ability to sense its position in space. Why this happens? Sensory nerves in the feet or spine fail to send accurate signals to the brain. Who's at risk? Older adults, diabetics, or those with a history of heavy alcohol use. 10. Cold hands or feet. Chronically cold extremities, even in warm environments, could hint at peripheral nerve issues affecting circulation. Root cause: autonomic nerve damage might impair blood vessel regulation. Associated conditions: Raynaud's disease, peripheral artery disease, or neuropathy. 11. Phantom sensations. Feeling sensations like itching, crawling, or even pain in areas without a physical trigger could stem from damaged sensory nerves. Neurobiology. The brain interprets mixed signals from injured nerve pathways as these phantom feelings. Mental health impacts. Persistent discomfort can lead to anxiety or frustration. 12. Vision and hearing disturbances. Blurred vision, difficulty focusing, or ringing in the ears, tinnitus, might relate to nerve damage affecting cranial nerves. Possible origins: multiple sclerosis, infections, or traumatic brain injuries. Consequences: left unchecked, these symptoms could escalate into more severe sensory impairments. Understanding the causes of nerve damage. Nerve damage can arise from various factors, including chronic conditions, diabetes, autoimmune disorders, or metabolic syndromes. Lifestyle factors: poor nutrition, excessive alcohol use or exposure to toxins, injuries or trauma, accidents, repetitive strain or compression, e.g. carpal tunnel syndrome. Infections: Lyme disease, shingles, or HIV. Diagnosing and treating nerve damage. Early diagnosis is crucial for managing nerve damage effectively. Healthcare providers may use electrodiagnostic tests to measure electrical activity in nerves and muscles. Imaging studies, MRI or CT scans to detect structural issues causing compression. Blood tests to uncover underlying conditions like diabetes or vitamin deficiencies. Treatment options include medications, pain relievers, anti-seizure drugs, or antidepressants for neuropathic pain. Lifestyle changes: improved diet, regular exercise, and cessation of harmful habits. Physical therapy to regain strength and mobility. Surgical interventions for cases involving nerve compression or severe trauma. Prevention and long-term care. Preventing nerve damage involves regular checkups, monitoring chronic conditions like diabetes, healthy lifestyle habits, balanced nutrition, limited alcohol, and staying active. Early intervention, addressing symptoms at the onset to prevent progression. Living with nerve damage requires ongoing care, but with the right approach, many individuals can manage symptoms and maintain a good quality of life.